Thank you so much to all of you for that, Claire, Wanda, and Joanne. I don't think that I need to formally introduce our next speaker, Joe Kotva, as you all have been getting to know him, and also a very long history here with MHF and ACHE. So, Joe, whenever you'd like to get started, let me make sure I can. You can share your screen, and we will go from there. Joe, we're back to the same thing last night where we are seeing the presenter mode.
And that and I have the same issue that the box for, oh, there it is. It's actually Zoom's covering up the display settings.
Oh, yep. Swap present. Yep, there you go. Perfect. Now we see it just as it's meant to be.
All right. Okay, so I should just let you know that most of these slides, most of this presentation was given at an interest group at the Society of Christian Ethics earlier this year. And the thanks there are to two former students. So Megan and Maggie were former ethics students at our medical school who actually developed a climate elective for the IU School of Medicine. So anyone across all our 9 campuses can do a full month elective in climate health. It is with me, but they're the ones who developed the curriculum for that. And then Amy Collins is with Healthcare Without Harm and has been a great ally. And when you see slides that are green at the bottom instead of red, that's because I lifted them directly from her. So there we go. The agenda is really, I think, pretty straightforward. The first part, I think, is the most evident, and that is that climate change is a health issue and it's a health equity issue. The second part is around healthcare's structural vulnerability to climate change. The third, I think, is something we don't think about a lot, and that is how much healthcare contributes to making the situation worse. How much of the carbon footprint is actually a function of healthcare. The fourth is that healthcare, there are some pretty remarkable things going on among some healthcare systems to address their carbon footprint and to build resiliency. And then to end on a hopeful, constructive note, and Ford's constructive, but also just to make us a little bit more aware of how much difference it makes to get people into green spaces and to create green spaces. This not only has carbon footprint implications, it has really remarkably direct health implications. So, so the health equity piece. In 2021, during the pandemic, right? So think about this. This is during the pandemic. 200 medical journals release a shared call on climate. saying that it is the greatest threat to global health. So we've got the COVID pandemic going on, which was catastrophic in many places. And yet all these medical journals are saying that's true, but this is worse, right? Um, and then in October of last year, the same journals, almost one for one, um, called on the UN to declare an emergency, saying that, basically we have to act and we can't keep sitting in our hands or going slow, thinking that that's going to accomplish anything. This, uh, if I could see all of you, I'd ask for a show of hands. Um, this is a CDC graphic that is used a lot, that's meant to give some sense of the, sorry, I'm going to try and fix my screen here. That's meant to give some sense of why climate change impacts every body system and every population, right? So whether it's through uh, the rising sea levels or extreme weather events like we're currently witnessing, or extreme temperature, um, that that has implications for weather, heat, air quality, water quality, ability to grow food, the changes on how vectors move from location to location and how widespread they are, disease vectors, the amount of allergens that are in a place. And then if you keep going out, you start to realize, well, wait a minute, there's not a single body system. There's nothing you can point to on a human body that isn't affected negatively by climate change. And there's not a single population base that you can say, oh, they're exempt. They're going to be fine. We There's polling data that suggests that most Americans think that climate will not impact them, and it's just remarkably naive. Um, so, well, this is a graphic that does very much the same sort of thing. It's trying to say um, climate affects all these different sorts of things. And then when you go to the bottom row, you start to see what the effects are on bodies, right? So whether we're talking about vector-borne diseases or waterborne illnesses or mental health distress or respiratory, cardiac or pulmonary and so on. Um, so if you're not aware, and I'll try to remember to put the link for this in chat, um, Project Echo, which is a shared work of the University of New Mexico and some other places, including Columbia, have been running really incredibly well done uh, um, monthly seminars on Wednesdays on climate health. And there is not a topic within climate health that they haven't covered. There's not a organ system that they haven't covered. There's not a population base that they haven't covered. Um, there's not an advocacy approach that they haven't covered. Um, there aren't there aren't approaches to fixing issues that they haven't covered somewhere in there, in the multi-year program. And it's not just that there's these 1 hour webinars, which are incredibly well done, but in the resources, there are then dozens of research papers and webinars and all these sort of resources underneath the main topic. So I can send you, my guess is this is too small for people to read. Is that right? Yeah. So that's only 3 pages out of at least 10, maybe 15 of topic headings. Everything from youth mental health around climate to physician advocacy approaches to uh, impacts on cardiovascular systems, pulmonary systems, impacts on indigenous groups, impacts on low-income groups, and so on. So it is by far the best resource that I know. So while it is absolutely true that nobody is exempt, the impact for marginalized communities is just worse. They are the first and worst hit of all groups. And that's just the HSS admitting as much. So, vulnerable, marginalized people are harmed first and worst. So, you think about Native Americans and Native Alaskans, uh, uh, they're almost 50% more likely to be harmed by sea level raises. African Americans are 34% more likely to live in areas affected by childhood asthma due to climate change. This data is only a couple years older. And by the way, we're already at the 2 degrees. People keep talking about 2 degrees, but we're at 2 degrees. For some reason, our conversation is always falling behind of the reality that's out there. So all the inequalities that we saw around social determinants of health, around equity issues that we saw with COVID are true for climate. So the same groups that we saw being devastated by COVID in unusually high numbers are also the groups that are first and worst impacted by climate change. This is just one example around heat stress. So elderly, pregnant, infants and children, chronic illness are all worse affected by heat events. And just on heat events, uh, events that used to be once every 10 years are now more than once every 3 years. Events that used to be once every 50 years are now more than once every 10 years. And this is accelerating. So what were highly unusual events are actually becoming the norm. I don't remember. This might be a CDC graphic, but it's really getting at some of the same things. So who is affected by what sort of implication of climate, and what are some of the mitigation things that can happen, right? So if we're talking about older adults and what happens when there are events that affect their dwelling places, what's happening to children, what's happening to low-income people around either mental health or around flooding, places prone to flooding. So I went through that fast, mostly because I'm assuming that people on here get some of that, right? Climate is everywhere. Climate affects everybody. Climate especially affects the people who are least equipped to deal with it anyhow. And the most vulnerable, marginalized groups, the groups with the least voice are the ones who are impacted first and worst. So that part, I think, should be pretty obvious to folks. Maybe this is obvious to people too, but healthcare, our current infrastructure is deeply vulnerable to the impacts of climate change. So this particular picture is only meant to indicate 3 ways in which we're vulnerable. Power goes down. You have to think about what happens to people who are on ventilators, what happens to people who are on dialysis, right? So you have to have backup power for all these things, and we don't. And interestingly, a lot of the backup power we have adds to the pollution and adds to carbon footprint. So instead of having sort of solar-based or wind-based uh, storage systems. Um, uh, oh, did you make me the host? Because we got somebody waiting to get in.
Got it. Thank you.
Um, so, power goes down, which happens a lot. Well, that affects healthcare, right? Um, Communication systems go down. That affects healthcare. The picture on the right there with that is an ambulance in a flood that has been uh, completely overwhelmed. Um, all those people survived, interestingly enough, in that particular one. I have lots of pictures of ambulances getting caught in floods. But this particular ambulance, all the people there survived, but the people who survived, including the patient who was being uh, carried, they had to wade through 6 feet high water till they got to dry land and then had to traverse dry land for a full mile on foot to get to some place where the person could get care. Right. So it's remarkable that they all came out of that okay, because it looks awful. Um, but it gives you a sense of what's going on here. Um, my understanding is that in Tennessee yesterday, a hospital was overrun by flooding from the current hurricane, that staff and patients had to be moved to the roof and evacuated and had to be taken out on rafts. So you had people who were on RVs and people who were on vents who were being taken away on helicopters and rafts um, from yesterday's storm. The slide is about Hurricane Sandy. You ended up having well in excess of 6,000 people evacuated, um, 6 hospitals and 26 residential care facilities were closed. That was just in New York City. You had a single hospital that had over $1 billion in damages and was closed for 2 months. You had an astronomical amount of years of research that was wiped out. And we've got in our heads that these are one-off events, but they're not one-off events. That's part of the thing, is that most of our healthcare systems are vulnerable to severe weather. They're vulnerable to the wildfire, air pollution. They're vulnerable to flooding. They're vulnerable to tornadoes, and so on. Um, that's just a quote from, I'll give you a second to read. Uh, so this is pictures of what happened in Boston. You see the flooding happening inside the halls of the hospital, the flooding that took out cars and uh, um, took out cars, but also emergency vehicles. This was the Norwood Hospital in 2020. Hurricane Laura. I don't know how many of you remember this, but this made big national news about the nurses that stayed behind in this terrible storm that was so terrifying, but they stayed behind to take care of these infants that couldn't be moved, right? So that made big national news, and they were heroes, and they were heroes. But what we didn't talk about is that 10 hospitals had to be evacuated um, because they lost all ability to have clean water. Um, and it's not just that the hospital systems themselves are vulnerable to extreme weather. Um, our Everything about our healthcare supply chain is vulnerable to extreme weather. So, we knock out power, we knock out communications, we flood our buildings, we pollute the air in our buildings. But even if you're in a place that's safe, you can be impacted by the fact that the extreme weather hits somewhere else, right? So with Hurricane Maria in 2017, um, uh, an awful lot of stuff was being made in Puerto Rico, but Puerto Rico's all of their manufacturing capacity around healthcare was devastated by Hurricane Maria, which meant then that virtually everywhere you had you had a lack of things like IV bags, right? Nobody had IV bags because we get them from Puerto Rico, but Puerto Rico wasn't making IV bags. Um, so like a lot of the supply chain things that we saw happen with uh, personal protective gear during COVID is that same sort of thing is true of severe weather events. Um, just because you're in a place, so, up here in the Midwest by the Great Lakes, um, we are, for the time being, exempt from a lot of things except tornadoes. Um, uh, our growing seasons might actually get a little bit better for a while. Um, uh, but you know, we still have tornadoes, but we also have supply chain issues that if we're getting our medication by some place that was hit, if we're getting our IV bags or our syringes or intubator tubes or whatever it is from some place that gets hit, then it doesn't matter that we're not currently getting hit. They're getting hit. And my only point there really is that um, if you start tallying it up, you realize that quite a few hospitals have already been closed for weeks or months at a time due to climate change. But because they always seem like one-off events, we're not putting it sort of in our heads that this is a regular occurring thing. And the more severe weather events we get, the more often that happens. And even if it happens to be the case that you're someplace that isn't getting hit, the because we're all so desperately interconnected, intertwined, somebody else getting hit still affects your ability to offer care, right? So somehow I'm going to go through these faster than I did the slides last night. So healthcare is just making it worse. Worldwide, healthcare is responsible for 4.5% of the total greenhouse gases. This is a study from Health Affairs, which is why that's there. Um, all the numbers I'm going to give you here are the most modest estimates possible. So these are people saying we are absolutely not doing less than this. We are doing at least this much. Some of the numbers I think are radically understating the issue, but these are the numbers we know that nobody, even the most conservative folks, cannot say are overestimates, right? So in the US, I assume everybody here is aware of this, but people in the US have per capita the highest emissions of anywhere in the world. The reality is that climate change is largely a function of the US. It's somewhat Western Europe. It is increasingly Asia. But if you want to know what caused climate change, it is us. We did this. It is our emissions that have been driving this because our emissions per capita are so much higher than anywhere else in the world. And we already have the highest per capita emissions in the world, and yet in the US, healthcare makes up at least 8.5% of greenhouse gas emissions, which is over a quarter of all the healthcare emissions worldwide. So our little country makes up over 1/4 of all emissions from all of healthcare everywhere. And it's at least 8.5% of that massive emissions that comes from the US, right? And by the way, I've seen studies that suggest that US emissions are more like 13%. Healthcare is more like 13% of the U.S. Emissions. I think that is almost certainly closer to correct, but 8.5 is what Health Affairs stands by, or this article in Health Affairs stands by. And at least up until the pandemic, U.S. healthcare systems were getting more polluting, not less polluting. So from 2010 to 2018, emissions from U.S. healthcare actually increased by 6%. So that's not a huge amount, but it's going the wrong direction, right? Instead of us becoming more efficient, more compressed, we were going in the wrong way. And that has very real world implications. Realistically, just from air pollution caused by healthcare in the US, 20,000 deaths per year are caused by US healthcare system from air pollution. And we got to get our brains around this, right? We worry about things like medical error, which is a big problem. We worry about, handguns, which is a big problem. We worry about a lot of things, but what we're not paying attention to is, if there's anything that healthcare agrees on is do no harm, but our healthcare system does a lot of harm. And it does a lot of harm to the environment, even if you're just talking about direct air quality. The pollutants that we're putting into the air, particulate matter, causes an enormous amount of harm. By comparison, estimates before we got Obamacare were that lack of health insurance was costing about 10,000 deaths per year. So lack of access to care was causing about 10,000 deaths per year. We're causing twice that many per year just from the particulate matter that our hospital systems are putting into the air, right? If we think about the ways in which hospitals are connected, or healthcare, more broadly, healthcare is connected, we should be honest that it is sort of very different levels. I have to hide all of you for a second. So the scope one are the things that hospitals have the most direct control over, because those are the things that they own, right? So it's their on-site boilers, it's the medical gases that they're releasing. We still have a lot of places using anesthesia gases that are worse than methane in terms of their heat trapping potential. And the hospitals not only are using these gases, but because they don't have anything useful to do with them, they just emit them into the atmosphere, right? So there's the sort of direct control that it's your heating system, your cooling system, your lights, right? So that's what's directly under you. Then there's the sort of secondary level where it's all the things that you're using that you don't have the most direct control over. So this is mostly about energy generation. So hospitals are healthcare systems by and large are insanely inefficient, and they use a lot of energy, and it's mostly non-renewable energy, and so that's a big contributor. And then you've got scope one is like 7 to 10%. Scope two is like 11 to 15%. And then scope three is everything else. And scope three is really all those things that intersect with healthcare. So it's moving your employees back and forth. It's moving your patients back and forth. It's bringing all your supplies into the hospital. It's the really reprehensible ways in which we make pharmaceuticals, the high impact ways in which we make pharmaceuticals. It's the transport of food. It's the type of food that we're using. So, you're sous-vide food, but you're sous-vide food that is itself has a very high carbon footprint. So when we say that hospitals and healthcare systems have a high carbon footprint. It's all of these things. It's the things within your building, it's your energy consumption, and it's all that transport and creation of goods that intersects with your institution. So this is just a graph, and it's one of the only graphs that I do not know where it came from. Um, because almost every organization that cares about climate and healthcare has used this, and I can't find it attributed anywhere. So it might be government created. Nurses for Climate Change might have created it. Healthcare Without Harm might have created it. It's just not clear. But it gives you a sense of some of the reasons why healthcare has such high greenhouse gas emissions, at least healthcare in the US. And the situation would be very similar in Canada. Energy use for heating and cooling, waste hauling. Yeah, I mean, just the amount of waste we create is incredible. Supply chain, pharmaceuticals, employee commutes, patient commutes. Um, just on the patient commutes, by the way, in the Philippines, there's a eye surgery clinic that decided that I'm jumping ahead a little bit, but it's remarkable how these things intersect. To address their climate footprint, one of the things they did is they kept their eye surgery patients longer. So their patients weren't going back and forth, back and forth, back and forth to home and to appointments. And what they discovered is not only were they able to massively cut their carbon footprint for all those patients they were treating, but their outcomes turned out to be better, right? So that seems counterintuitive, but we need to be looking and thinking outside the box on some of the things about whether some of our assumptions about what makes for good healthcare is always what actually makes for good healthcare, or if we were doing them to save ourselves money at the cost of carbon footprint. Um, so here's the reality of the US healthcare sector. If we took US healthcare and we said US healthcare is its own country, and then we compared it to all the other countries in the world. So what are the carbon footprints of all these different countries? US healthcare would be the 13th most carbon footprint problematic country in the world. And US healthcare produces more emissions than the entirety of the UK, right? Now, the UK is a good example because they're not good. This is not a country that has a particularly small footprint per capita. And yet our healthcare system produces more emissions than the entirety of the UK's the entirety of the UK. This is just an example that some IU students down in Indianapolis did to give us, a sort of micro view of the problem in healthcare. So this was about 5 years ago, they did a trash audit. Well, 4 years ago. And all they looked at was the per day trash output of 5 operating suites, sorry, in the IU system down around Indy. And those 5 operating rooms by themselves were producing 200 pounds of trash per day. Most of that trash is plastics. Plastics are petroleum. They are direct causes of climate change gases, right? So it's not just the quantity of waste, which itself is a problem, right? All the energy that goes into getting rid of that waste. But the waste itself is one of the drivers of climate change. And if those are just 5 operating suites, those aren't those entire hospitals, just 5 operating suites from 5 sections in Indy think about how big our healthcare system is and what we're doing in terms of just waste. Um, so this is actually a slide that um, I have for another purpose, but I left in here for you all. And that is, um, uh, this is not really a question. This is actually a statement. We have too much healthcare. Um, you know, we're spending 18% of the GDP on the most expensive healthcare system in the world. We do not have good outcomes compared to the other advanced industrial nations. And the issue is that we spend our money on the wrong things. Um, we're spending money on interventions after people are sick rather than spending money on the interventions that keep them healthy. And most of the interventions that keep them healthy also um, have better climate impacts. So if you're creating green spaces, you're keeping people healthy and you're reducing your carbon footprint. If you're creating public transportation and active transportation networks, infrastructure, you're keeping people healthy and you're reducing carbon footprint. If you're creating uh, food as medicine programs that are localized, you're reducing carbon footprint and you're making people healthier, right? It's it's that if we really want to make people healthier and we want to address our carbon footprint, we have to be thinking much more about moving money from interventions to, uh, socioeconomic, socio-structural determinants of health. Um, Having said that, I will tell all of you that um, I I find these kinds of graphics also problematic. Um, you see that physical environment only gets 10% on both of these charts. Nobody believes that's true. I don't know why those charts keep going out this way. Physical environment is easily 30 or 40% of this total, especially when you look at how physical environment is um, defined, because physical environment includes things like water and air quality, your zip code, the affordability of housing, and so on. Um, Physical environment is easily way more than that. And there's not a chance in the world healthcare, clinical care makes up 10 or makes up 20% of human health. It's just there's no way in the world it's that high. 10, 15%, yeah, but more than that, absolutely not. Um, yeah. So these charts are helpful in that they get us to think away from the clinic, but they're not helpful in that they don't actually match the research. The research is much more on socioeconomic and physical environment, and those two factors driving the health behaviors. My own suspicion is that we tend to talk about health behaviors a lot because we still want to blame people for being ill. Okay, so climate change affects health, everybody, everywhere, especially the poor and marginalized. Our healthcare systems are increasingly vulnerable as they stand to extreme weather events and other factors of climate change. Our healthcare systems are a major contributor to worldwide carbon emissions. So what are some systems doing? Um, so is that too small? Can people read that? Kate, you're the only one I can see right now. Um, I really want people to know about what I really want people to know most about are Echo, Project Echo, and Healthcare Without Harm. Because if you want resources that you're going to learn from and that are going to empower you with workable solutions, these are the organizations you need to know. Project Echo is going to teach you and give you tools. Healthcare Without Harm is an organization that mobilizes especially physicians and nurses and healthcare systems to change what they're doing. And that particular link there will take you to a lot of their resources, including more recent resources than some of the ones I'm going to show you. And I'm assuming we could probably just send out an email later that has some of the links to these things. I can't really put things in the notes right now. So one example of things with healthcare without harm is this particular one now is getting a little dated. It's from 2017. But it's about building low carbon and resilient healthcare systems. You have somebody else who wants to join. So this tool here talks about what sustainable building design looks like, what energy efficiency looks like, what sustainable waste management looks like, what sustainable transport and water policies looks like, and so on, right? So what does climate smart healthcare look like? This is another one of their resources that was co-developed with some other groups. So high impact things. So if your healthcare system is trying to reduce its carbon footprint, you know, go for some of the low hanging fruit. These are some of the things that have the biggest impact. Get renewable energy. I'm going to come back to that in a second. Renewable energy, zero emissions buildings, so LEED buildings, sustainable transport and travel. So we ought to be building electrified systems for our healthcare systems, incentivizing low carbon pharmaceuticals. Again, our pharmaceutical production is very carbon intensive, and it doesn't need to be. Yeah, it doesn't need to be. Implement what they call circular healthcare management. Circular healthcare just is reuse, repair, and recycle toxic-free products. And we throw away, like 80% of what we throw away is entirely, can be designed to be reusable. We've gotten into these unbelievable habits of waste because they're convenient, because they're easy, but they're very costly. They're cost intensive, and they have high carbon footprints. And then the efficiency thing is actually pretty evident as soon as you start thinking about it. The more effective your healthcare is, the less carbon intensive it is. So basically, the more often we have to readmit people, the higher the carbon footprint is. The more we have to have them keep coming back, the worse it is. And the more we can intervene early and better, the lower our carbon footprint. So quality of care matters to our carbon footprint. Oh, sorry. I wanted to talk about 1 second about the renewable energy. This is one of the ones that just sticks with me. I can't quite get my brain around. Almost every large healthcare system in this country has the space to have solar and wind generation that would exceed their needs. On their rooftops and on their parking facilities and those kinds of places. It's not every system, but the vast majority of systems have the space to create energy generation that would exceed what they use. Now, it's fine if you want to buy the energy from a utility and incentivize them, but I cannot get past the short-sightedness of not making the capital investment of generating localized power. It is it is in the long-term financial interest of healthcare systems. The majority have the space to do it. It does require a large initial capital outlay, but our systems find the money to build buildings, but they're not finding the money to build sustainable energy generation. That would make their neighborhoods cleaner. It's in their long-term financial interests. It makes them more resilient to energy outages. And so that particular one just sits with me as in addition to some of the waste, is I can't quite get why it is so hard to sell this. So the so in 2001, Hurricane Allison caused this hospital system to evacuate 1,000 patients, and the system sustained $2 billion in damages. Again, systems are vulnerable to climate change. The staff were running around the hospital with flashlights, and all the patients had to be vented by hand, right? The water actually took out their emergency generators. So it's not like they didn't have emergency generators, but the storm was bad enough that it wiped out their own backup power system, which, by the way, is not all that unusual. So when they rebuilt, they spent $50 million in upgrading infrastructure to be more resilient, to be less vulnerable to flooding, to have their energy generation in a different place, and so on. And so in 2017, with Hurricane Harvey, the hospital sustained almost no damage, no costs, and they were able to stay operational throughout the whole thing. We can build systems that are much more resilient to extreme weather events, but we have to design them for the kind of weather that we are likely to get in a particular place, right? So this was an investment in one system, $50 million upgrade that made all the difference in the world when they had their next extreme weather event. This is an NIH graph that is trying to promote some of the things people are doing elsewhere. So wind-resistant construction. So if you're in a place that like this place in Missouri, you have to build for the kind of weather events you're going to encounter. So wind is the big problem here. So they built for that. The one about Katrina is only partially realized and partially still in the works. But the idea is to build a system that can deal with the catastrophic flooding. There was a Kansas town that 90% of the town received damage, and the healthcare system was all but wiped out. And so they not only rebuilt with construction to deal with the kind of weather that they were going to encounter, but they rebuilt to harness the wind that is also sometimes their enemy, right? So wind generation. You've got the wildfires that are becoming problematic for air quality. So you've got hospital systems that are building systems to keep their interior air clean and healthy for patients and staff. So all of these are either done or in the works, but those are examples of healthcare systems trying to be more resilient. That doesn't mean those particular healthcare systems have all that great of climate of carbon footprints. The Kansas one is a good example because they're taking on their own sort of energy generation. So Kaiser is doing a lot to build carbon neutrality into their system. They have really nice videos talking about what they're doing, and it's yeah. So this is their efforts, improving building efficiency, installing on-site solar, yay, purchasing renewable energy when they can't build it on site. Carbon offsets, a lot of carbon offsets aren't really offsets, but the stuff that Kaiser is doing really is, because the things they're investing in are things that allow those places to massively reduce their carbon footprint. So, excuse me, when they cannot reduce their own carbon footprint in a specific way, they invest in somebody who can do that. So the example I have here is just the clay pot water filters in Guatemala that not only give people clean water, but it does it in a massively more carbon footprint friendly way, right? So if I can't reduce my carbon any further in this particular sense, I can invest to allow you to do it, right? Um, uh, and frankly, if you're in trouble with carbon offsets, you can always plant trees. The evidence is that if we would massively invest in reforestation, we could buy ourselves at least a decade, which is a lot, which would help. Um, so yeah, carbon offsets can be done right. They often are not, but they can be. They are looking at those scope 3 footprints, so they're trying to invest in reducing transport of patients, of doing that in environmentally more friendly ways, in incentivizing pharmaceutical companies to reduce their own carbon footprint, and so on. Uh, so greenhouse gas emissions down by 50% by 2030. I think Kaiser is actually going to exceed that. Net zero by 2050. Incidentally, 2050 is just too late. We should be all looking at, I mean, if we're honest, we should all be looking at net zero by 2030. But 2040 is a much better goal than 2050, but I appreciate what Kaiser's doing. And do I have one more on them? No. So I don't know where my So one of the things Kaiser has done is they've massively cut down on business-related travel, right? So that's a low-hanging fruit, but you can do that. They've also looked at where they're purchasing the things. So how much can you do locally? How much can you purchase from places that, instead of just looking at the cost of an item, look at the carbon footprint of the manufacturer, that sort of purchasing. So this is, I encourage all of you to go to YouTube later today and look up MedStar Harbor Hospital's tree planting effort. It's really quite inspirational. So this is a Baltimore neighborhood. This is a system that provides care for low income and marginalized people. They had a big problem with stormwater runoff. It the place would flood, like all their parking lots would flood, the grounds would flood. They had a really big problem with it, and they dealt with that problem almost exclusively by using trees and plants. So instead of saying, oh, we have to build massive newer sewer systems, they said, what can we do with trees and native plants? And it was nearly 50,000 uh, plants. And they made the place beautiful. They created a healing garden in the process. They made their parking lots beautiful, or at least around the parking lots beautiful, by putting in all this greenery, right? So you create a place that is better for staff and patients in terms of green spaces for them to interact with. And you dealt with this massive problem of stormwater runoff. Um, uh, Locally, the city of South Bend, this is not a healthcare system, but the city itself for the St. Joe River would overflow and was increasingly overflowing into um, one of the parks and some other areas, and it was again a massive problem. But instead of creating more sewer systems for it, they used a plant mediation so that uh, uh, it's beautiful. It's absolutely gorgeous, and you can walk around in these things. But when we get one of these severe weather events, the plants do what they evolved to do, and they mediate all that excess water so that it doesn't then go into the streets and into the houses and into the rest of the park. Um, in any case, this hospital in Baltimore, they worked with the Arbor Day Foundation. They got a campus tree status which is both a certification, but also they got some money to help them do tree care, right? And they worked with the Baltimore Tree Trust to build an urban forest. So they didn't just do this work on their own campus. They took those same insights and helped the city build green space that is also a little carbon sink for the neighborhood. And then they've focused on reducing waste and figuring out what kinds of materials can be reused. So this is a very small system compared to a lot of them. They had to be very creative about money, but they got a vision and said, we can fix problems, make life better for our neighbors, and reduce costs for a hospital system by going all in on plants and energy efficiency. Providence, St. Joseph Health is currently my healthcare system hero, because I mean it's also, I mean they also are doing other things right, but they said this is a Catholic system that set a very big goal. So they're not just looking for carbon neutrality, right? So Kaiser's saying we want to be carbon neutral by 2050. Providence is saying we want to be carbon negative by 2030. And that's a very big goal. And I mean, in all honesty, I don't think they're going to make it. They're going to make a lot of progress towards it. But they're going to be carbon negative way before 2040. And they're not just looking at neutrality. They're saying, if we're going to fix this, if we care about our neighbors, we have to figure out how we help take carbon out of the air, not just minimize our own sort of footprint. So their acronym for all of this is We Act. So their main focus points are on waste, energy and water, agriculture, food, chemicals, and transportation. So as of 2021, so 3 years ago, they already had two of their hospitals had seen a 50% waste reduction. So I don't know where they are in 2024. But in 2021, they had already reduced by half. By 2021, they had 26 of their facilities were 100% on renewable energy. They have been developing gardens and CSA programs and have been developing prescription produce programs, and all of it's localized. So sometimes they are developing their own on-site urban gardens. Sometimes they are partnering with existing CSA programs. Sometimes they are partnering with local farmers markets, but this is both an effort at sort of food as medicine for chronic healthcare issues, but that's also a way of addressing their carbon footprint, right? Um, uh, yeah, I mean, I'm not sure how many people on this call are aware that for many of us, our largest carbon footprint is not our transportation, it's our food. The fact that we continue to eat animals is a bad idea. It's not just a bad idea for the animals, it's a bad idea for carbon footprint. And almost all scientists who have studied this have said we have to at least stop eating all large animals. We just have to, because it's directly tied to deforestation, to improper land use, and to the animals themselves are just carbon producers. Anyhow, Providence and agriculture developing a lot of on-site food and localized food production that has those dual benefits of more efficient care because we're providing better chronic condition management. So that's better for the patient. It's less costly overall. It's better for carbon footprint if it's done right. Got to be done right. They have almost entirely eliminated the analgesic agents that are greenhouse gases. And they looked at things like all their computer systems and what would it mean to get computer systems that are produced in ways that are less carbon intensive and then are more readily and honestly recyclable so that the materials can be reused, right? So all their computer systems across their entire system now are as energy efficient and recyclable, renewable as is currently possible. They have eliminated, as of already in 2021, they had eliminated 90% of all business travel, right? As the sort of first step in saying, well, how do we address transportation? Now, let's be honest, we have to do a lot more about transportation. Hospitals are going to have to get sort of integrated with electrified and public transportation systems. But, you know, Providence has taken a big swing, and I appreciate very much the fact that they have committees, they have executive support aimed at saying, as a Catholic institution where the Pope has called us to care for the planet, we have to do something differently if we're going to care for our neighbors. And, you know, are they going to make carbon negative by 2030? I don't think so. But the fact that they realize that neutrality by 2050 or even 2040 is not enough is a big deal. And I appreciate what they are modeling for everyone else. So that's just some of what's going on in healthcare. There is a lot of low-hanging fruit where systems can save a lot of money while also becoming much more efficient and providing better care for their patients. So benefits of so I said I wanted to do sort of more uh, upbeat things. The latter part of this, right? So upbeat is hospital systems that are genuinely trying. Um, there are other systems. Healthcare Without Harm keeps track of them in a way I do not. Um, there are other systems doing bits and pieces of this, but things like Kaiser and Providence are trying to be whole system reductions and looking at every facet of their care. Um, but we also need to just recognize that climate action and engaging in nature are good for us. They're good for the people on our staff. They're good for people in our neighborhoods. They're good for our students. They're just good for us. Going back to Project Echo, um, this is um, uh, some of their stuff on sort of eco distress among the youth and among mental health and how you help people along. But um, uh, Professor Hayhoe has this right, and that is you act to have hope. It's not that you're acting because you have hope. You're acting in order to have hope. And um, I see this constantly in my students that if you just tell them about climate change, it's overwhelming and debilitating. You have to give people things they can do. And when you give people things they can do, they become much more energized and much more hopeful. And it it becomes almost that snowball down the hill, which is going to melt. Um, but it becomes that increasingly thing where when they start to realize they can do things that actually have an impact, even if they're modest impacts, that they can do things that have an impact, it empowers them to do more things, and it gives them hope, and it frankly is a much better mental health space to be in. So I just think that's right, and that I encourage all of you to be looking for things that your students can do, whether they're letter writing campaigns or going into their churches to talk about things that the people in the pews can be doing to reduce their carbon footprint, or going to rallies, or changing to plant diets, or getting on their bicycles. You know, uh, the more the students do, the more hopeful and energized they are about what more they can do. Um, so the other part of that is just that uh, human beings evolved to be in green spaces, and not being in green spaces is bad for us. It's bad for the planet. It's bad for us. You know, part of the reason the planet is heating up is we keep putting these gases in the air. But part of the reason the planet is heating up is because we keep um, building things that retain heat, um, which is the opposite of what green spaces do, right? So in one study, uh, it, if we could cover just all the blacktop that we have in this world, just the blacktop, all the roads and surfaces that we've covered in blacktop, and we would paint all those spaces with a light color, not remove it, just paint it with a light color. It would be the same impact as eliminating all carbon emissions everywhere in the world for a year. That's how big it is. We keep building things that exacerbate the problem. It's not just that the building themselves are energy carbon intensive, which they are, like concrete is incredibly carbon intensive. Um, but we build them in a way that makes heat retention worse. And we have to be thinking differently. And one of the things you do is you cover the planet with plants. It's better for carbon, but it's also better for us. And it's better for our mental health. It's better for our physical health. It's better for our relationships. So these are just a couple of resources. Greater Good Science Center has a lot of stuff on the health benefits of being in nature and things like what does all seem to do to us? Like if we try and look at this not just from a religious perspective or a poetic perspective or a philosophical perspective, but if we try and understand what's going on in the human body, what happens when we sit in awe? What happens to cortisone levels? What happens to, our synaptic processes? What happens to our cardiovascular system? What happens when you are captivated by awe? Or this book by Lucy Jones, Losing Eden. A lot of this, but not all of her work is on mental health, but it's also, she covers some of the physical stuff that that so many of our maladies get better, so many of our chronic conditions get better if we get people into green spaces. And we seem to be underutilizing one of the most ready um, therapeutic interventions we have, and that is create more green spaces, put people in the green spaces. They're better. And they're better on all causes. So it's not just like mental health. Mental health is clearly better when people get to interact regularly with green spaces. Every study says this across the board, but it's all of our other body systems are better. So our cardiovascular system does better. Um, so we've known for a long time, actually, that if you fill neighborhoods with trees, that people have fewer heart events. We've known this for a while. This particular study is trying to, instead of being an observational study, it's a causal study trying to look at what actually is going on here. And it's another piece of the puzzle. I'll be honest, I care less about why than the fact that it works. Um, uh, you get people access to green spaces, they have less heart attacks. It doesn't even have to be exercise. And that's the thing. Like you could say, oh, green spaces means they're becoming more active. That's probably part of it. But it turns out you can just put people in green spaces and let them meditate or walk through them or anything, and they get healthier. This is true for pulmonary. This is true for cardiovascular. It's true for a lot of our chronic conditions, even fibromyalgia gets better if you give people access to green spaces. So, there is a movement to make integration into parks part of part of prescribing. So you've got this Park RX program. I love it in terms of if you get people next to nature, they get healthier. If you get them next to nature, maybe you can get them more attentive to their own carbon footprint or into creating green spaces near them. We do need to create more spaces and not just be sending people off to other spaces that exist, right? But the parks program has lots of data to say that relationships are better when people are in green spaces. People's mental health is better and their physical health is better when you get them into parks. We know this. The data here is completely overwhelming. There's no meaningful doubt about it. We've got to get people into green spaces, and we have to create more green spaces. So if you can get people within half a kilometer of green spaces, all-cause mortality goes down, right? Everything goes down. And the thing is, everything gets better. Gun violence goes down, assaults goes down, burglary goes down, perception of safety goes up. use of outdoors, so exercise goes up. If you get people near green spaces, human interaction gets better. Um, uh, so depression gets better, hopelessness gets better, violence gets better, relationships get better, cardiovascular health gets better, pulmonary health gets better, mental health gets better. Like everything gets better. We got to create green spaces. Um, and, this is a lovely picture of sort of maximizing space. So if you're not going to cover your roof with solar panels, then cover your roof with a garden. Um, it will actually make if you do it right, it will make your building more uh, extreme weather resistant. But it's also just better for everybody. This is a local example, local-ish. This is Eskenazi in Indianapolis. Um, I only found out about this um, urban farm that's on top of one of their roofs. Uh, because one of my students was doing their clerkships there, and or maybe fourth year elective residency, I don't or rotation, I don't remember. Um, but we were talking about the importance of green spaces, and he said, "Well, how many of you have spent time on the roof at Eskenazi?" And Uh, this place is currently being redone. They've had this rooftop garden for 10 years, and they're trying to re-envision it now so that it still produces a lot of food, but that it has more spaces for people. You've always been able to go up there, but they're trying to create more spaces for more meditative meeting spaces for people. And they're trying to put more emphasis onto native plants that are native to Indiana. Uh, this urban farm on top of one of their roofs produces thousands of pounds of vegetables and herbs that are used then in the kitchens of the hospital, right? So you create a space that is good for people to be in. You create a space that then produces healthy food for people in your building to eat. Um, it's, I mean, Eskenazi is um, uh, largely a safety net hospital. They're disproportionately care for marginalized people. But this is just a lovely space and a lovely idea about creating it. It's the original idea was more food as medicine and green spaces, but I'll take that. Um, if you're creating healthy food for the people in your building and you're giving them a space to be that isn't just institutional walls, that's better for everybody. And if you do it right, it's also reducing your carbon footprint. Um, so um, this is not a healthcare system, but Interfaith Power and Light as an organization focuses primarily on they have three tracks. One is job creation, one is climate and energy, and I don't remember what the other track is. But the current CEO is Mennonite. It's always had a strong Anabaptist Mennonite affiliation. Um, but what the story is about is the group of churches in the Midwest that got a like I think it was a $1.6 million grant um, from the Forestry Service to improve urban tree canopies. So this is churches being missional by collaborating with other groups to say, what if we create more green spaces, more tree canopy for our neighborhoods who lack that? So this is an action of solidarity. It's an action of justice to say everybody should have green spaces. Everybody should have trees. Um, uh, I do not remember the director of Interfaith Power and Light. We had him speak at one of our events at the Society of Christian Ethics. for our healthcare group. And when they got this grant, part of it was that the federal government now has data that talks about how much money is saved in healthcare for every single tree they plant. So there's this disproportionate gain in saved healthcare costs that you can track tree by tree, which is insane to me. I mean, tree canopies really need you need a mass for it to be really effective. But they can break it down to how much did we invest in these 15 trees and what is the dividend from that. And there's a huge healthcare cost payout to planting trees in our neighborhoods. And faith communities were deeply involved in this particular initiative. And this particular initiative also has a lot of Anabaptist and Mennonite connections. So I'm going to stop. Those are my main points. I went pretty darn long. So that's my contact information again. And I'm going to end this so we can talk and I can actually see all you lovely folks. So
Thank you so much, Joe. I agree with Joanne's comment. It can be a little bit overwhelming and easy to lose hope, but then when you also go into, there's some things that are not that hard to do that can make a really big difference. And to see those differences is amazing. I think in the interest of time and staying on schedule, the best thing to do would be to take our half-an-hour lunch break. Let's see, how are we going to do this? Let me check my own schedule here. Would be to go ahead and take our lunch break, which is actually an hour. Now, Joe, are you able to come back at about 12:30 for folks who have questions?
Yep.
Awesome. Then we'll do that. We've got about 30 minutes.
I might be sweaty, but I'll be back.
That's okay. That's often me these days. But we'll have then kind of a 30 minutes to talk with Joe, ask some questions, and then we will transition to our final keynote talk of the weekend, which is Dodanim, who is here with us now, which is great that he can be with us. And from there, we will have our very, very last session is what we're calling our parking lot conversations, right? Because when we're in person and you're leaving, you end up chatting with some folks in the parking lot for longer than you intend to. And we love that. And so we wanted to try to recreate that a little bit. So in that case, I will actually end this session of the Zoom, but it'll be the same link at 12:30. And we really look forward to discussing all of these pieces you've brought up, Joe, at 12:30 Eastern time. So 11:30 if you're on Central. And we look forward to seeing you then. Thank you, everyone. And thank you very much, Joe. That was really, really, really good.